Okay, so the task I decided to do today for today's video is sitting in a chair. So this movement is a coordinated movement, initializing a sequence for controlled descent, and it's powered by eccentric muscles to contract and lengthen under a load. Okay, so now I will show you the task that I'll be analyzing. So once again, the task is sitting in a chair. I kind of angled my computer downwards, so we have my little stool here. So we're just going to go right here. So we'll sit in a chair like this. Okay, so now that we went over the action, I'm going to be going over some joints and muscles involved and other things that help us perform that task. So first we're just going to go over the joints that are involved, the first one being the hip joint. Okay, so I have it pulled up already. The joint type for this is that it's a synovial ball and socket joint. It's formed between the head of the femur and the acetabulum. The action this provides is flexion of the hip, so that's just, to put it into clear terms, bringing the thigh closer towards the torso, going at 90 degrees. So this initiates the motion of sitting, allowing for the hip hinge to be the first movement to descend down. As we do this, the torso is moving forward and then the thighs come up, and then this assists in managing like posture while we're seated, so we're upright and tall. So the next joint we're going to talk about is the knee joint. So this type of joint is a hinge joint. It's one of the largest joints in the body. It is formed between the femur, tibia, and patella. This joint allows for the action of flexion, so it flexes to bend the leg at the knee at 90 degrees. So this allows for the lower part of our leg to bend and lower slowly as we descend down to the chair. This is essential for the movement, and it helps with shock absorption, just so we're not like falling into the chair, but we're going down slow and controlled as our knees are able to bend. So now we're going to get into the muscles that are involved in this action. So first we're going to go over the iliopsoas muscle group and the two muscles that help contribute to this action. Okay, so the first one we're going to go over is this one right here. This is the psoas major. The origin for this is the transverse process of L1 to L5, and then the vertebral bodies of T12 to L5. The insertion is the lesser trochanter of the femur, and then the action this allows for is flexion of the thigh at the hip. So, and then it helps flexes our trunk forward. So it's just like the action of the hip joint. So it just lets our thighs come towards our torso. Okay, so we're gonna do this muscle next. This is the iliac crest muscle. So the origin of this muscle is the iliac crest, the superior iliac fossa, and then the anterior sacroiliac ligaments. The insertion is lesser trochanter of the femur, and then it also like kind of inserts into the tendon of the psoas major muscle. The action for this is that it also flexes the thigh and flexes flexes the trunk. Okay, so next we're going to go over the next muscle group that helps us complete this action. So the next one are going to be the adductor muscles. The adductor muscles work as synergist muscles to help us do this action. Okay, so the first one in this group we're going to go over is this one right here. This is the pectineus muscle. The origin for this is a superior pubic ramus. The insertion is the pectineal line of the femur, and then the action for this is that it adducts and flexes the thigh. So adducts is just moving the leg closer to the body, closer to the midline, so bringing the leg together, and then flexes the thigh is when our thigh comes towards our torso. Okay, the next one is going to be this one right here. This is adductor brevis. The adductor brevis muscle, the origin for this is the body of the pubis and then the inferior pubic ramus. The insertion is the medial lip of the linea aspera of the femur, and then the action is that it also adducts the thigh at the hip joint. So once again, bringing it towards the other leg. Okay, so the next one is going to be This one right here, this is the adductor longus muscle. The origin for this is the anterior surface of the body of the pubis, and then the insertion is the gluteal tuberosity, and then the linea aspera, and then the medial supracondylar. So the action for this is that it adducts, flexes, and extends the thigh at the hip joint. So adduct, just bring closer, flexes, thigh comes towards our torso, and then extends is when we are pushing our leg backwards. Backwards just meaning straightening from a flexed position. Okay, added a layer. So the next one is going to be this one right here. This is the adductor magnus muscle. The origin for this is the inferior pubic ramus and then the ischial tuberosity. The insertion is the gluteal tuberosity and then the linea aspera and then the medial supracondylar. The action for this is that it adducts, flexes, and extends the thigh at the hip joint, so just like the adductor longus. Okay, so the next one is going to be this one right here. So this is the gracilis muscle. The origin for this is the body of the pubis and the inferior pubic ramus. The insertion is the medial aspect of the proximal tibia, and then the action for this is that it stabilizes the thigh and supports hip flexion. So hip flexion is when the thigh comes towards the torso. Alright, so the next muscle group we're going to go over is the quadriceps femoris muscle group. So this muscle group allows for lengthening under tension. It is important for controlling on the descent down. This muscle group can be seen as an agonist in order to complete this task. Okay, so for the first one we're going to do is this one. So this is the vastus medialis muscle. The origin for this is the medial part of the intertrochanteric line, and then the insertion is the ischial tuberosity. The action for this is that it extends the leg at the knee joint, so just extension of the leg. So this is mostly for like when we are trying to get up from sitting. Okay, the next one is going to be this one right here. So this is the vastus intermedius muscle. The origin for this is the anterior and then lateral surface of the body of the femur. The insertion is the tibial tuberosity, and then the action is it extends the leg at the knee joint. So the next one is going to be right here. So this is the vastus lateralis muscle. The origin for this is the intertrochanteric line and the greater trochanter and the gluteal tuberosity. The insertion is the tibial tuberosity and then a tendon of the quadriceps. The action for this, it extends the leg at the knee joint. Then the next one is going to be this one right here. So this is the rectus femoris muscle. The origin for this is the anterior inferior iliac spine. The insertion is the tibial tuberosity, and then the action is that it extends the leg at the knee joint, and then it also flexes the thigh at the hip joint. Okay, the next muscle group we're going to go into is the hamstring muscles. So for this muscle group, it allows for stabilization of the pelvis and helps slow hip flexion. So since it helps slow hip flexion, these muscle groups are seen as the antagonist muscles. Okay, so the next one for this group is going to be this one right here. So this is the semimembranosus muscle. The origin for this is the ischial tuberosity. The insertion for this is the medial condyle of the tibia. The action that this muscle provides is flexes and medially rotates the leg at the knee joint. So flexes, bringing the thigh closer, and then medially rotates the leg, so bringing it inwards. It also allows for extension of the thigh at the hip joint. So the next one in this group is going to be right here. So this is the semitendinosus muscle. The origin for this is the ischial tuberosity. The insertion is the medial aspect of the proximal tibia. The action for this is that it flexes, immediately rotates the leg, and then also extends the thigh of the hip joint, so just like the semimembranosus muscle. So the next one for this group is going to be right here. So this is the short head of the bicep femoris. The origin for this is the linea aspera, and then this lateral supracondylar line. And then the insertion is the head of the fibula. The action for this is that it flexes and laterally rotates the leg at the knee joint. And the next one is going to be right here. This is the long head of the biceps femoris. The origin for this is the ischial tuberosity. The insertion is the head of the fibula, and then the action is that it flexes and laterally rotates the leg at the knee joint and then extends the thigh. Okay, so there's another muscle group that helps contribute, and that is the calf muscle. So that's the gastrocnemius and the soleus. These muscles help work as synergists, and they just help stabilize the lower leg and help control the position, so we're balanced and we have a better center of gravity. We're not just all wobbly. So we'll go over this one. So this is the soleus muscle. The origin for this muscle is the head of the fibula, the posterior surface of the fibula, and then the medial border of the tibia. The insertion is the posterior surface of the calcaneus. And the next one is going to be this one, and then we'll just multi-select so we can get both of them. So this is the medial and lateral head of the gastrocnemius muscle. So for the origin for the medial side is the medial condyle, and then the popliteal surface of the femur, and then the insertion is the posterior surface of the calcaneus. And then for the lateral head, it would be the lateral condyle and then the lateral supracondylar line of the femur, and then the insertion would be the posterior surface of the calcaneus. So another antagonist muscle group that we have went over previously in another video would be the gluteus maximus muscle. This would be an antagonist just because the glute max helps to try and keep the hip extended. Well, when we're doing this action, we need the hip to go into flexion just in order to be in a seated position. So muscle atrophy is when there's decreased muscle size and strength. So if an individual tried completing this action but had muscle atrophy, they would find some difficulty completing this task. Weakened iliopsoas muscle group would lead to reduced hip flexor strength, difficulty in initiating the movement, and then unstable lowering. So this would just cause them to try and use momentum in order to descend into the chair. If the individual had atrophic quadriceps, this would just result to no control on the descent, so they would, like I said before, fall or plop into the chair just using momentum. This would lead to a loss of the eccentric control as we're slowly descending into the chair. So just because these muscles are unable to function properly, they are going to start to engage other stronger muscles like the gluteus, which would then externally rotate the hips, causing for the motion to become unsafe and uncoordinated. And then if the individual had weak antagonist muscles, which would be either the hamstring group or the gluteus group, this may result to a backwards lean, and as if they're trying to lean back and try and sit, or too much of a forward lean when they're sitting. Okay, so yep, those were some of the joints and muscles involved in order to complete the task of sitting in a chair.